Hey guys, so I had a lot of people ask me, well, how do I come off PPIs? Well, first of all, I'm not a medical doctor. This is something you need to do with your GI, but this is a discussion that I would have with my GI. So first of all, my number one critique about putting people on PPIs as the first line of action is that often acid reflux is due to weakening of the lower esophageal sphincter, which is a sphincter between your throat, your esophagus, and your stomach. And that is often due to a hiatal hernia. A lot of people will show negative on ultrasound for a hiatal hernia, but it can be functional. In other words, the hernia can come in and out. And so when the stomach does protrude through that sphincter, it does weaken the sphincter, and that can potentiate acid reflux. Another thing is low stomach acid. When you have low stomach acid, there's delayed gastric emptying into the small intestine. Food ferments, creates gas, creates that pressure. Also chronic stress and chest breathing. If your diaphragm is not moving, your rib cage is not moving, then that increases the likelihood of getting a hiatal hernia or getting acid reflux. And so whether it's getting adjusted, doing more diaphragmatic breathing, loosening that rib cage, or doing any kind of relaxation stress work, that is going to help, it's going to help with acid reflux. It's going to help you coming off PPIs if that's what you want to end up trying. But for those of you who go straight to trying to increase stomach acid right away, obviously the sooner you come off PPIs, the easier. But if you were to just take betaine hydrochloric acid, which is, acidic, it's not going to be a fun time. So, the first thing I would do, and again, discuss this with your GI, is talk about increasing motility. Whether it's through herbs or otherwise, you need to increase motility so that dumping happens from the stomach into the small intestine sooner. Also, you want that sooner to happen because with PPIs, you have delayed gastric emptying. That has downstream effects. How? Small intestinal bacterial overgrowth. When one valve is delayed, usually other valves, such as the ileocecal valve or the valve of Houston, they get delayed. Another thing is gallstones. Basically, bile it gets ejected from your gallbladder at the duodenum of the small intestine once food empties into the small intestine, and that slows down with delayed gastric emptying, so the bile becomes thicker, and that's what can eventually contribute to gallstones. Also, the fact that the acidity of the food in the small intestine is what triggers the pyloric sphincter to close. So you need stomach acid. So you need to increase motility. Once you've been increasing motility and you've been coating the lining of the stomach, that's number two, so you could tolerate more acid, then you could start playing around with coming off PPIs and then trying to increase stomach acid. But the order really matters a lot.